The complete blood count can help clients in evaluating the cells that are circulating in her blood, allowing for the detection of possible diseases such as anemia.
Conversely, blood typing determines the blood group of the client if she is type A, B, AB or O, which is important during blood transfusions, as well as to know whether she is Rh positive or Rh negative, making this a crucial test in preventing the life-threatening condition called hemolytic disease of the newborn or HDN.
Another test was the hepatitis B surface antigen, which is recommended to ensure that infants born to hepatitis B surface antigen positive women receive post-exposure prophylaxis, which is up to 95% effective in preventing perinatal hepatitis B virus infection. On the other hand, the urinalysis test is for the client to assess her bladder infections, diabetes, dehydration, and preeclampsia by screening for high levels of sugar, proteins, ketones, and bacteria.
As nurses, it is our duty to practice our nursing responsibilities before, during, and after these laboratory and diagnostic tests. It is also necessary to have our patient be informed about what these tests are, why they are done, how they are done, and the discomfort that they may feel when the skin is punctured.
Before the test, the nurse would advise the client to avoid stressful events because this could affect her physiological condition, thus causing her hematological values to change. The nurse should also inform the client that fasting is not required but eating fatty meals is discouraged. In the course of the actual test, the nurse ensures that the medical technologies has sanitized the tools that will be utilized for the laboratory and diagnostic procedures.
After these tests, it is important to observe proper disposal of the instruments such as syringes and needles to avoid unintended pricking. She would also advise the client to observe the puncture site for blood clotting and bruising. The client would also be instructed to resume normal activities and diet.
The nurse would ask the client to drink plenty of water before the urinalysis so that she could provide an adequate amount of urine sample. The nurse also explains to the client how to obtain a clean catch urine sample to achieve an accurate test result. When handling the urine specimen that was collected, the nurse should take standard precautions. That is all for the interventions and the laboratory diagnostic test for the client, and the next topic is about health teaching.